I'm Dionycio. This is my medical assessment video. What's my scene looking like?
You're at Anoka Technical, and there's a dummy that has a shortness of breath issue.
Okay.
He is tripoding, and he is struggling to breathe.
Okay. I have one patient with shortness of breath. I'm not going to need any C-spine stabilization. I'll request additional backup, EMS, ALS backup. And I'm going to say, before we start anything, I have my proper PPEs on and the scene is safe. How alert is my patient?
Your patient is awake, they're alert and oriented, and I guess they can try and speak a few words at a time, but they're struggling to breathe.
Okay. I'm gonna guess my my airway is patent.
It is.
And how are they breathing?
They're breathing at a rate of 30 respirations per minute, and their quality is normal.
Okay. That's still pretty quick. It's normal depth, you said?
Yep.
Okay. I'm gonna move on and check circulation. Do they have a pulse, and how's that?
Their pulse is 120, and it's fine,
Okay.
I guess. Yeah.
Normal bounding. I'm gonna guess, are they bleeding at all? Probably not.
They are not.
Okay. What's the color of your skin?
They're blue and cyanotic.
Okay. Now that I know that, I'm gonna want to do some oxygen therapy. I'm gonna get an SpO2 reading, but I'm gonna probably put them on high flow oxygen to begin with, since their skin is blue. What is my SpO2?
It is 88%.
88%, yeah, so we're gonna continue that high flow oxygen. Will I be able to get a sample history from him?
Sure.
Okay. Signs and symptoms, troubled breathing.
Yep, there's no other signs. That's
yeah.
it.
And then allergies?
None.
Medication?
None.
Past medical history?
They have damn it. They have asthma. They don't have anything prescribed for them though.
They don't have asthma without anything prescribed to them. It's a very odd scenario. But that is going to be helpful. Last oral intake?
This morning when they ate breakfast.
Okay. And events leading up to this?
They were doing CPR on that other dummy that's lying over there.
Okay.
And then they got short of breath.
Okay. I'm gonna think, because of the asthma history and the troubled breathing and what led up to this, I'm gonna probably administer 2.5 milligrams of albuterol, even though it's not prescribed to them, and it should be prescribed to them.
Yeah, probably. I should remember
maybe
that.
those papers are lost. We don't know. But now that we know that, so we'll administer that along with the oxygen. So we know the onset, but what makes it better or worse?
They feel a little bit better in a tripod position, but it's not. They're still struggling to breathe.
All right. Is there any pain in anywhere? Or is it just breathing?
It's just the shortness of breath. There isn't any pain.
Okay. And then how long has this been happening?
This has been happening for about 5 minutes.
Okay. Now that we know that, I'm just gonna check for some lung sounds now that we have the full history. What do they sound like? Just rapid?
You have wheezing on expiration.
Okay, wheezing on expiration.
Mm-hmm.
Because of that, we already administered albuterol, but that's what makes me think that you would need it. And then I guess this is a high priority patient, just because it's trouble breathing. the mechanism, or what's being affected is pulmonary.
Yep.
Right now, I would say we could move on to, before we move on to anything, I want to get a set of vitals for transport.
All right. What vitals do you want?
What's his blood pressure? Give me that.
His blood pressure is 110/70.
Okay, that's pretty normal. Heart rate is at.
I think I said like 110 or 120. I don't know. Whatever.
Yeah.
One of those.
I think it was like 120. So. Maybe.
Sure, it's still
Okay,
120.
So it's a bit high.
You already know the SpO2. I think I said like 88.
So now that we have that, that changed at all with oxygen and albuterol?
I guess the blood pressure goes up a little bit. The heart rate comes down a little bit. The pulse ox goes to, let's say, 94.
Mm-hmm.
Their skin is looking a little bit better, not so blue.
Okay. These are good signs of improvement.
Yep.
Based upon this, I do think we are ready for transport at this moment. What I would tell whoever's receiving the patient is we have a 20-year-old dummy who is having trouble breathing, shortness of breath. We administered 25 milligrams of albuterol, and we gave him high flow oxygen on the way to transport, and his vitals are improving. And while on the way to transport, we're going to check on the vitals every 5 minutes.
Okay, is that all?
That is all.